Response adaptive randomization is a technique used in adaptive clinical trials that works by actively adjusting the randomization ratio of participants assigned to each study group during the course of the trial based on the outcomes of patients who are already enrolled. So this essentially has the effect of increasing the number of patients who are assigned to the better performing treatment arm, when there is one, all without compromising the scientific integrity of the study. This type of design is becoming more common in clinical trials and actually has been shown to increase patient participation in a hypothetical acute stroke trial when compared to a standard fixed randomization trial design. However, in time-sensitive emergency settings, such as you see with acute stroke patients, the rapid communication of this more complex trial design can prove to be difficult. And as a result, patients are less likely to understand it. Therefore, we hypothesize that if we adjust the trial description in a hypothetical stroke scenario presented to patients in the emergency department by integrating brief comprehension questions into the consent process, then we would actually be able to improve understanding of the trial allocation procedure for response adaptive randomization and further increase patient participation. So what we did is we surveyed 720 patients over the course of 2 summers in the University of Michigan Emergency Department. Patients were verbally consented and randomized to one of 4 groups. They viewed a video of either a response adaptive randomization or a standard hypothetical acute stroke trial with or without the addition of interactive comprehension questions. The additional questions that were integrated into 2 of the groups addressed research procedures relevant to the consent process and operation of the trial. For example, one of the questions asks, who or what decides which treatment I will get in this trial? After watching the video, subjects were asked whether or not they would consent to the trial and also if they could identify the method of randomization and allocation used. The results of our study were interesting. They showed that 85.9% of individuals who were assigned the video describing the response adaptive randomization trial with the addition of the comprehension questions were able to correctly identify the trial allocation method, as compared to only 60.4% of individuals who were assigned the video describing the response adaptive randomization trial without the addition of the comprehension questions. This 25.5% increase was statistically significant, and furthermore, we also found that there was significantly higher trial participation in the response adaptive randomization interactive video group. So through this study, we showed that by integrating structured comprehension questions into the consent process of a hypothetical acute stroke trial, you can actually increase understanding of the response adaptive randomization trial design and further attract more research participation. And as a result, we believe that improving the communication of the trial procedure within a simulated situation that mimics the rapid discussion regarding an emergency research trial is beneficial and should be incorporated into future stroke trials.